सो हेलो गाइज होइन आज चाहिँ हामी एमएसके है एमएसकेमा एमएसकेको हामी आर्म सेक्सनमा डिल गर्न गइरहेका छौँ है। सो पहिला सुरुमा चाहिँ हामी आर्म सोल्जर र ब्रेकिल प्लेक्सस पढिसक्यौँ है। आज चाहिँ आर्म पढ्नेवाला छौँ र सुरुमा चाहिँ आर्म पढ्नु अघि चाहिँ हामी चाहिँ बोन पढ्नेवाला छौँ है। सो आर्मलाई डिल गर्ने दुईवटा बोन चाहिँ हामी अभियसली पढ्ने नै छौँ है, स्क्यापुला र ह्युमेरस है। सो स्क्यापुला मैले अघिल्लो लेक्चरमा धेरै भनिसकेँ है। सो दिस इज दि सब स्क्यापुलारिस फोसा है। सुरु गरिहालेँ है। दिस इज सब स्क्यापुलारिस subscapularis. This is subscapularis fossa. This subscapularis fossa है, जहाँबाट चाहिँ subscapularis muscle is originated, that is inserted in the middle lip of the bicipital group है. So this is the head of the humerus. This is the head of the humerus. This is the anatomical neck, and this is the surgical neck. And there is a greater tubercle, and there is a lesser tubercle. There is a bicipital group or intertubercular sulcus, and okay, this is the glenoid cavity that articulates with the head of the humerus, and there is the medial epicondyle, which is more prominent. Medial epicondyle, that is on the medial side of the hand, and there is the trochlea, which articulates with the ulna, and the capitulum, which articulates with the radius. Okay, and there is the radial fossa. Okay, radial fossa and the coronoid fossa. So coronoid process, so coronoid process of ulna fits on coronoid fossa. So coronoid process of ulna fits on coronoid fossa during flexion of arm, flexion of elbow joint. So elbow joint को flexion गर्दाखेरि ulna को coronoid process fixes on the humerus को coronoid fossa मा है. So fossa भनेको खाल्टो, process भनेको projection. So projection चाहिँ खाल्टोमा fit हुन्छ, that prevents the further flexion of the elbow joint है. So this is the humerus. Okay, so humerus को पनि detail मा आउँछ पछि. So these are the coracoid process. This is the acromion. This is the anatomical neck. I already said that. There is the epiphyseal line in case of the growing bone. In case of the growing bone, so if this is the growing bone, there is the epiphyseal line or the epiphyseal growth cartilage, and this is the clavicle. Okay, so lateral epicondyle, common extensor origin. So lateral epicondyle, lateral epicondyle and the medial epicondyle. This is the medial epicondyle. So lateral epicondyle is common extensor origin because it gives rise to the most of the extensor muscles of the forearm, while the medial epicondyle is the flexure origin, common flexure origin, because it gives origin to the most of the flexure muscles of the forearm. So this is the humerus. So this is the lesser tubercle. Okay, lesser tubercle. This is the greater tubercle, and this is the head of humerus. This is the anatomical neck. This is the surgical neck. Okay, this is the bicipital group. So bicipital group, this is the bicipital group or intertubercular sulcus. So there is a V-shaped, in the lateral side there is a V-shaped deltoid tuberosity. So where is the deltoid muscle is inserted and originated from the lateral and outer border of the acromion and the clavicle. So okay, this is the coronoid fossa, and this is the radial fossa. Okay, this is the trochlea, and this is the capitulum. This is the medial epicondyle, and there is the lateral epicondyle also. There is the olecranon fossa also. Fossa means khalto. So there is olecranon process in ulna. Olecranon process in ulna that fits on olecranon fossa during extension of the elbow joint. During extension of elbow joint. So elbow joint, so there is lateral epicondyle, and this is the TS of the arm, this is a TS, transverse section. So if we see the transverse section, there is a mid prominent humerus. Okay, this is the humerus, and there is the lateral intermuscular septum. So these intermuscular septums are the modification of the deep fascia of the arm. So medial intermuscular septum and lateral intermuscular septum along with the humerus divides the arm into the two compartments. One is the flexor compartment and anterior or flexor compartment, and another is the posterior or extensor compartment. Posterior अथवा extensor compartment. This is posterior अथवा extensor compartment. So this is the outer biceps brachii. So there are three muscles in the anterior compartment. So three muscles in anterior compartment. Anterior compartment. There are three muscles in anterior compartment. So there is biceps brachii. There is coracobrachialis. So, and there is the brachialis. And there is only one muscle. There is only one muscle in posterior compartment of arm. Posterior compartment of arm मा चाहिँ एउटा मात्र muscle हुन्छ, that is the triceps brachii. Okay, so this is the triceps brachii, and this whole muscle in the posterior compartment of the arm is the triceps brachii. So triceps brachii is the largest muscle in the posterior compartment of arm. It is the only muscle in the posterior compartment of arm, and it has three heads. So this is the lateral head, and this is the medial head. Okay, this is the medial head, and there is the long head. Sorry, so this is the long head, this is the long head. Okay, this is the long head, and this is the lateral head, and this is the medial head. So triceps brachii has the 3 heads. So the name suggests triceps. So triceps means 3 heads, while the biceps means 2 heads. Okay, so there are 2 heads in the biceps and 3 heads in the triceps. So 2 heads in the biceps. So 2 heads in the biceps are the long head and a short head, while the 3 heads in the triceps are the long head. So medial head and lateral head, medial head and lateral head. So तीनटा हेड हुँदो रहेछ ट्राइसेप्समा चाहिँ, बाइसेप्समा 2टा हेड. So triceps are the main अथवा only the muscle है that is present in the posterior compartment of the arm. So anterior compartment मा 3वटा muscles, biceps brachii which is present superficially, त्यसपछि brachialis and coracobrachialis है. brachialis अथवा biceps brachii पछि coracobrachialis, initially coraco माथिपट्टि coracobrachialis, तलपट्टि चाहिँ ब्रेकियालिस है. सो कोराको ब्रेकियालिस यहाँ देखेको छैन किनभने यो चाहिँ अलिकति तलको सेक्सन होला सायद है. सो कोराको ब्रेकियालिस देखेको छैन यसमा. So this is the biceps brachii. So biceps brachii, as I already said, there is the 2 heads, short head and long head, and it is inserted into the radial tuberosity, which is discussed later. This is the pectoralis major, which is the main muscle of the chest. Hey? So this is the deltoid. This is the deltoid where we prefer the IM injection. Where we prefer the IM injection. So okay, these are the extensor carpi radialis longus and extensor carpi radialis brevis, pronator teres, brachioradialis, which will be discussed later in the cubital fossa. And these are the extensor muscles of the forearm, which will be discussed in the forearm section. And there is obliquus externus, which is the muscle of the abdomen. Okay, so triceps brachii has a long head, medial head, and a lateral head, which is not seen here. Okay, so this is the lateral view. Okay, this is the lateral view of the hand of the arm, lateral view of arm. This is the large muscle. This large muscle is a deltoid. Okay, this large muscle is a deltoid. And there is the acromion process. Okay, over this there is the trapezius. This is trapezius, and there is the teres minor, and there is infraspinatus. There is a teres major. There is latissimus dorsi, and these are the lateral head of the triceps brachii. There is a long head of the triceps brachii, and okay, there is pectoralis major, which is a large muscle of the chest. There are serratus anterior. There are external oblique muscles. These are external oblique muscles. Okay, so this is the sternocleidomastoid, and this is omohyoid muscle. Hey, so there is the clavicle also. Okay, that much. Hey, so there is levator scapulae also. Okay, levator scapulae. Okay, so यो lateral view देखाउन खोजे हल्का muscle को बारेमा मात्र. So let's go to the muscles of the anterior compartment. That is the biceps brachii, which is the superficial muscle. Superficial muscle that originates from the 2 parts. 2 parts part originate भाउँछ. So as I already have mentioned, there is a long head, long head and the short head, long head and a short head. So long head originates from the supraglenoid tubercle. Long head originates from the supraglenoid tubercle, while the short head originates from coracoid process. So these are the, so this is the short head. So this is the short head that originates from the coracoid process, and the supraglenoid tubercle is inside the joint, shoulder joint. So the tendon of the long head of biceps brachii passes through the intertubercular sulcus and penetrates the joint capsule to go, and it originates from the supraglenoid tubercle right here. Okay, यहाँदेखि चाहिँ supraglenoid tubercle हुन्छ, and there is infraglenoid tubercle from which the long head of the triceps brachii originates. So these are inserted. So these are from the 2 heads. So this is the long head, and this is a short head, and they fuses and they get inserted into the radial tuberosity. So this is a radius, and there is the insertion of the biceps brachii. So this is the radial tuberosity. Okay, this is a radial tuberosity, and the flattened tendon of the biceps brachii goes towards the medial side, forming the flattened tendon called bicipital aponeurosis. So aponeurosis simply means the flattened tendon. Okay, this is the flattened tendon, and the bicipital aponeurosis also forms the okay, we will talk later, right? So this इसको action को कुरा गर्छ भने it helps in the supination. So biceps brachii also helps in the supination of forearm. It helps in supination of forearm. Arm also is a flexure muscle of elbow of arm. Arm अथवा elbow joint भनौं न. So elbow joint मा चाहिँ flexion गराउँछ यो muscle चाहिँ. So this muscle is supplied by a, so all the muscles in the, so एउटा कुरा सम्झाइ, all the muscles in the anterior compartment of arm, is supplied by musculocutaneous nerve. This is the musculocutaneous nerve. Musculocutaneous nerve. Okay, musculocutaneous nerve, which root value is C5, C6. Okay, this is a musculocutaneous nerve. Why called musculocutaneous? Because it supplies muscles muscles of arm, it supplies muscles of arm and the lateral skin of forearm, है. सो lateral skin of forearm लाई सप्लाई गर्ने र muscle of arm लाई सप्लाई गर्ने हुनाले यसको नाम के आयो भन्दाखेरि दिस इज द musculo because it supply muscle and cutaneous because it supply skin, so it's the musculocutaneous nerve. Okay, है, यो पनि बुझिराख है. So there is the bicipital aponeurosis right here, as you can see there is the bicipital aponeurosis projecting towards the medial side. So it is a broad aponeurosis biceps brachii that is located in the cubital fossa. Okay, it separates the superficial from deep structure in fossa. So it originates from the distal insertion of the biceps brachii. Okay, distal insertion of biceps brachii, and there is tendon of brachialis also. So brachialis is inserting into ulnar tuberosity. Okay, it helps in the, so bicipital aponeurosis helps to protect the brachial artery. It helps to protect the brachial artery. Wait. It helps protect the brachial artery and median nerve. Brachial artery and median nerve. Okay, during vein puncture. Okay, यति सम्झे हुन्छ. So bicipital aponeurosis helps to protect the brachial artery and median nerve. Okay, then there is another muscle known as, okay, loaded boy. So there is another muscle that is the brachialis. So now brachialis बाट जाम. So brachialis originates from the distal half of the anterior surface of humerus. So this is the distal half of the anterior surface of humerus. So it originates from the distal half. So distal half of anterior surface of humerus, anterior surface of humerus. Okay, distal half of anterior surface of humerus, and it is inserted into the coronoid process and the ulnar tuberosity. Inserted into coronoid process and ulnar tuberosity. Okay, there is also another muscle known as coracobrachialis because it originates from the coracoid process. So coracoid process originate bhayera it is inserted into the medial half of humerus. Medial side proximal half bhanau na. So this is proximal half, medial side proximal half of the humerus, है. So these both muscles are supplied by the musculocutaneous nerve, है. So musculocutaneous nerve, है. So okay, and there is the triceps. Okay, triceps is the muscle of the posterior compartment of the arm that originates from the there are three origins of the triceps brachii, and there is one insertion, है. So insertion is सजिलो छ सम्झनलाई. Insertion सम्झे पहिला. Insertion is the olecranon process. Olecranon process. This is the olecranon process, and the origin is from the long head origin चाहिँ infraglenoid tubercle. There is infraglenoid tubercle, है. Infraglenoid tubercle, and the medial head को चाहिँ medial side of the humerus भयो, and lateral head को चाहिँ lateral side of the shaft of the humerus, है. So triceps brachii को तीनटा origin हुन्छ, है. So lateral head को चाहिँ posterior surface हुँदो रहेछ, है. So lateral head को चाहिँ posterior surface, lateral head, है. Lateral head को चाहिँ there is posterior surface of humerus. So posterior surface of humerus superior to radial group. There is superior to radial group. So radial group, है. So radial group भने चाहिँ यस्तो हुन्छ कि so humerus को पछाडिपट्टि, है. So if this is the humerus in the posterior view, है. Posterior view मा हेर्यो भने so यो humerus हो भने so there is a group, है. So there is spiral or radial group, है. So radial group भनेको जहाँ चाहिँ radial nerve हुन्छ के. So there is a group or के नाम there is a spiral group अथवा radial group. So यसको ठ्याक्कै माथिबाट हो, यहाँबाट चाहिँ there is the origin of the lateral head, है. So lateral head को origin त्यहाँबाट भयो. So medial head को चाहिँ just inferior to the radial group, के. So medial head को चाहिँ यहाँ भयो. So medial head, this is the medial head, this is the lateral head, है. This is the lateral head. So the lateral head को origin यहाँबाट भयो, and there is the origin of medial head, है. So medial head र lateral head को origin भयो. So as you can see here, है. So this is the lateral head. So this is the lateral head, and this is the medial head, है. यतातिर this is the medial head. So there is the radial group. Okay, so यो पनि भयो, है. Triceps brachii पनि भयो, and अब हेर, है. So this nerve is the musculocutaneous nerve. यो त हल्का देखाउन राखेको. So this is the bicipital aponeurosis. Okay, this is the biceps brachii and the large deltoid muscles, and the pectoralis major. This is the pectoralis major. This is serratus anterior or something like your teres major होला सायद, है. So there is the brachioradialis, brachioradialis. So यो पछि आउँछ यो कुरा, सबै छोड्यो. Okay, हामीले हिजो कहाँसम्म हेर्थ्यौँ. So this is the medial cord, this is the lateral cord. Okay, this is the second part of axillary artery, है. This is the second part भयो भने, so this is the second part भयो नि. So this is the medial cord because it lies in the medial side. This is the lateral cord because it lies in the lateral side, and there's the posterior cord in the back of the second part of artery pasadi, second part of axillary artery pasadi चाहिँ there's the posterior cord from which the radial nerve arises that supplies. Okay, साँच्चै मैले एउटा कुरा बिर्सिन्छ. So triceps है, triceps brachii है, triceps brachii. So triceps brachii are supplied by the radial nerve है. So radial nerve ले सप्लाई गरे हुन्छ ट्राइसेप्स ब्रेकाइलाई चाहिँ रेडियल नर्भले सप्लाई गरे हुन्छ. ओके ठीक छ. सो भने पछाडिबाट चाहिँ एक्सिलरी नर्भ र रेडियल नर्भ निस्किन्छ. सो एक्सिलरी नर्भ चाहिँ around the surgical neck of humerus rotate गर्छ, while the radial nerve passes to the radial group and it will emerge in the anterior side. Oh, this is the radial nerve. Okay, so यसरी आउँछ के घुमेर, अनि एक्सिलरी नर्भ त यसरी घुमेर भयो. अनि musculocutaneous nerve is the branch of the lateral cord. So यहाँ देख्न सक्छौ, this is the musculocutaneous nerve and this nerve terminates with the lateral cutaneous nerve of the forearm. So musculocutaneous nerve supplies the anterior compartment of the arm, and while it supplies the cutaneous part. So this supplies the lateral cutaneous part of the forearm, forming the lateral cutaneous nerve of the forearm. Okay, there is the median nerve which is formed by the union of the lateral cord को branch र medial cord को branch मिलेर चाहिँ median nerve बन्छ. So यसको root value चाहिँ C5 to T1 हुन्छ है, all root है, all root. जस्तै गरी radial nerve को पनि all root आउँछ है, यसको C5 C6 हुन्छ है, C5 C6. Okay, यसको C8 T1, C8, यसको C8 T1 है. यसरी चाहिँ सम्झिनु पर्यो तिमीहरूले चाहिँ है, रुट भ्यालु चाहिँ सोधिरहेको छ. सो अल्ना नर्भ चाहिँ टुवर्ड्स द मिडियल साइड एन्ड जस्ट बिहाइन्ड द मिडियल एपिकोन्डाइलको जस्ट बिहाइन्डमा हुन्छ. सो मिडियल सो देयर इज अ ब्रेकियल आर्टरी है. सो लोवर बोर्डर अफ टेरिस मेजरबाट द एक्सिलरी आर्टरी इज नाउ कल्ड इज ब्रेकियल आर्टरी, एन्ड द ब्रेकियल आर्टरीलाई चाहिँ यो मिडियन नर्भले, सो मिडियन नर्भले ब्रेकियल आर्टरीलाई यसरी, पहिला यो चाहिँ ल्याटरल साइडमा हुन्छ मिडियन नर्भ चाहिँ. सो इनिशियली द मिडियन नर्भ इज द ल्याटरल साइड अफ द ब्रेकियल आर्टरी, बट व्हेन इट प्रोग्रेस डाउनवर्ड्स है, इट गोज टुवर्ड्स द मिडियल साइड अफ द ब्रेकियल आर्टरी. सो क्युबिटल फोसामा आउँदासम्म, सो द मिडियन नर्भ लाइज मिडियल टु द ब्रेकियल आर्टरी के है, यो पनि बुझिराख है. So median nerve lies medial to the brachial artery, and this is the brachial artery. Okay, this is divided into the radial artery and the ulnar artery, and this is ulnar nerve, and this is the this is the radial nerve, and then the lateral cutaneous nerve of the forearm, which is the continuation of the musculocutaneous nerve of the arm. यसै बुझिराख, यसरी सम्झिनु है. ओके ओके यहाँ है. सो देयर आर दि ब्रान्चेस अफ दि ब्रान्चेस अफ दि ब्रेकियल आर्टरीको ब्रान्चेस भन्ने पनि भयो यहाँदेखि तल त है. सो आर्टरी इन आर्म के आर्टरी सप्लाई इन आर्म, खासमा यो चाहिँ सिबिएसमा पढ्नुपर्ने, जस्ट ओभरभ्यू मात्र है. सो देयर इज दि एन्टेरियर एन्ड पोस्टेरियर सर्कमफ्लेक्स ह्युमेरल आर्टरी, द्याट सर्कमफ्लेक्स भनेको घुमाएर सप्लाई दि नेक अफ द ह्युमेरस, सर्जिकल नेक नै सप्लाई गर्ने हो खासमा. द्याट वुड फर्म दि एनास्टोमोसिस विथ द सोल्जर जोइन्ट है, सोल्जर जोइन्टमा एनास्टोमोसिस गराउँछ. सो देयर द पोस्टेरियर ह्युमेरल सर्कमफ्लेक्स आर्टरी अलङ विथ द एक्सिलरी आर्टरी इन द क्वाड्राङ्गुलर स्पेस है. एक्सिलरी आर्टरी र पोस्टेरियर ह्युमेरल सर्कमफ्लेक्स आर्टरी, देयर आर वान आर्टरी, सरी एक्सिलरी नर्भ है, माई ब्याड, एक्सिलरी नर्भ. This is the axillary nerve है, sorry there is the axillary nerve and the posterior humeral circumflex artery है. इन दुईटा चाहिँ पास हुन्छ थ्रु दि क्वाड्राङ्गुलर स्पेस है. दिस इज क्वाड्राङ्गुलर स्पेस है, क्वाड्राङ्गुलर स्पेस पछि ब्याक पढ्दा हुन्छ, क्वाड्राङ्गुलर स्पेसबाट पास हुन्छ पछाडि है. अनि देयर इज द प्रोफन्डा ब्रेकियल आर्टरी. ओके, दिस इज द डिप ब्रेकियल आर्टरी एन्ड अल्सो द रेडियल नर्भ है. सो देयर इज one nerve and one artery, one nerve and one artery. So it passes on the lower triangular space है, this passes on the lower triangular space है, दुईटा भयो. So this is the humeral nutrient artery which passes through the nutrient foramen of the humerus, and there is a superior ulnar collateral arteries, there is the inferior ulnar collateral, and there is a ulnar recurrent arteries, anterior and posterior ulnar recurrent arteries, and there is a common interosseous artery. Okay, interosseous artery. Okay, arterial supply खासै चाहिदैन, मैले जस्ट ओभरभ्यू दिनलाई मात्र. So यहाँबाट चाहिँ यहाँबाट it will divide the radial artery and the ulnar artery. So there is a radial recurrent also. Okay, ठिक छ, यो चाहिदैन. So there is also vein है, vein को पनि छ यहाँ, धेरै कुरा छ vein को पनि. So there is the medial basilic vein, medial to the basilic vein, and lateral cephalic vein. Okay, these veins, basilic veins penetrates the deep fascia. Okay, they form the median cubital vein. This is the median cubital vein. So this is the medial cubital vein, and this forms the basilic vein of the forearm, and this forms the cephalic vein of the forearm. So median cubital vein are the common site for the common site for IV injections. So IV injections को लागि पनि हो, IV injection भन्दा पनि. So common site for vein puncture के, sorry, IV injection भन्दा आइज. So vein puncture है. So vein puncture गरेर blood withdraw गर्ने common site is the median cubital vein है. That is just above the tendon of the biceps brachii, अथवा just lateral to the biceps brachii को यो bicipital aponeurosis को just lateral मा छ नि त. So just upper अथवा lateral है, just upper lateral है, superior lateral side. Okay, this is the elbow joint complex. Okay, elbow joint complex that the तीनटा bones है. This is the humerus. So humerus को this part, and there is the this part is the capitulum, and this part is the trochlea. So trochlea articulates with the ulna, which is a medial bone, while the capitulum articulates with the this radius. So this is the lateral bone, and there's a there's the annular ligament which forms the joint between the proximal or radioulnar joint. So proximal radioulnar joint. proximal radioulnar joint. There is also proximal radioulnar joint, so which is covered by a ligament in the ligamentले कभर गरेको हुन्छ के सो रेडियसलाई यसरी समातेर राखेको हुन्छ सो यसरी समातेर राखेको हुन्छ सो दिस द medial epicondyl which is more prominent than the lateral epicondyle so okay this is the annular ligament है annular ligament हो यसरी घुमाएर राखेको हुन्छ के सो annular ligament भयो and there is the radial notch of the radial notch हुन्छ है ulna चाहिँ there is the this is the coronary process and this is the olecranon process है this is olecranon process, this is the coronary process and okay, this is the articulation. Okay, there is the flexion extension movement, and there is the supination and pronation. So supination and pronation. So during pronation, the ulna moves over the the radius moves over the ulna. Radius moves over the ulna. Ulna को माथि radius जान्छ. So there is supination, pronation, and okay, यो चाहिँ अघि नै आउनु पर्ने खासमा यो पछि राखेँ मैले किन राखेको पनि थाहा छैन. So there is the supraspinatus that is inserted into the superior facet of the greater tubercle. That is the also there is the infraspinatus that is inserted in the medial facet. Hey? So there is the teres minor that is inserted in the inferior facet, and there is the teres major which is inserted into the medial lip of the intertubercular sulcus, and there is the long head of biceps brachii. And this is the lateral head that originates just above the spiral group, and this is the medial head that originates just inferior to the radial group. Right? So this is the radial group, the humerus. Okay, radial group of the humerus. Okay, so this forms the quadrangular space. You can see here. Hey, this is the quadrangular space. So quadrangular space को boundaries so there is the upper, right? Upper मा के छ माथि चाहिँ there is the teres minor, and lower मा के छ there is the teres major, right? Teres major, so minor by major, and there is laterally, so medially के छ medially there is the okay long head of biceps, long head of triceps, है long head of triceps को long head छ है त्यसपछि laterally के छ lateral border चाहिँ this the shaft of humerus. So shaft भन्दा पनि भयो, this is neck of humerus, especially neck of humerus, there is neck of humerus. So these are the boundaries of the quadrangular space. And there is a lower triangular space here, you can see lower triangular space, and there is the upper triangular space. So upper triangular space बाट dorsal scapular arteries pass हुन्छ है, dorsal scapular arteries, lower triangular बाट there is okay quadrangular space बाट pass हुने चाहिँ एउटा nerve र एउटा artery. So एउटा nerve एउटा artery, one nerve हुन्छ, so one nerve one artery है, so lower triangular space बाट pass हुने पनि one nerve one artery. So there is one nerve called axillary nerve. This is the axillary nerve, है axillary nerve र artery चाहिँ this is the posterior circumflex humeral artery, posterior circumflex humeral artery, है humeral artery, posterior circumflex humeral artery. And there is one nerve in the lower triangular space, that is the radial nerve, which passes towards the back, back of the arm. So radial nerve and the deep brachial artery or profunda brachii artery, deep brachial artery. So deep brachial artery. Okay, this is using mathiko quadrangular space भयो, this is lower triangular space, है. So lower triangular space को boundary हेर्छौँ भने this is the shaft of the humerus on the lateral side, this is the shaft of the humerus, and this is the long head of biceps brachii and the teres major, this is the teres major, है. So यसलाई चाहिँ lower triangular space पनि भयो है. Okay, so as you can see from here, this is the lower triangular space, है lower triangular space, there is the profunda brachii artery or deep brachial artery, and there is the radial nerve, है in the radial group, or spiral group, and okay radial group भयो, यसरी घुमेर जान्छ. So यही देखाउन खोजेँ यसमा चाहिँ खासै केही छैन. So in elbow joint मा हेर्छौँ भने this is the ulnar nerve just behind the medial epicondyle. So this is the medial epicondyle को just पछाडि चाहिँ ulnar nerve छ है. So this is the ulnar nerve, है. So this is the ulnar nerve. So there is the median nerve in the cubital fossa. So this is the radial nerve. Which gives two branches. That is the deep branch, deep branch and superficial branch, deep and superficial branch, And as you can see here, also this is the radial nerve. Okay. So if there is breakage to the humerus causing damage to the radial nerve, especially in the radial group part, radial group मा चाहिँ if there is a fracture, that damage the यो के भयो radial group मा चाहिँ fracture भयो भने चाहिँ it will damage the radial nerve, which results in the radial nerve palsy, simply called a radial nerve paralysis. So radial nerve supplies most of the extensors, so it supplies the extensors, simply extensors of the upper limb को extensor muscle supply गर्छ. So extensor muscle supply गर्ने हुनाले there will be the impaired function अथवा there loss of function of the extension, there will be the wrist drop. This is a wrist drop, So radial nerve को injury मा depend गर्छ. There is two types of radial nerve palsy. This is crotch palsy, है. This is called crotch palsy, and there is Saturday night palsy, So Saturday night palsy, यो भन्दा अगाडिको brachial plexus को लेक्चरमा क्रच पाल्सी र Saturday night palsy को बारेमा भनिसकेको छु है, नहेरेको भए हेर्नु है. This is क्रच पाल्सी and Saturday night palsy. Okay, so this is the cubital fossa. So cubital fossa, this is the cubital fossa. So cubital fossa is a depression in the just superior to the elbow joint. So यसको boundary हेर्छौँ भने in upper side मा there is यस्तो हुन्छ cubital fossa. This is cubital fossa. So cubital fossa is formed by in the upper end, the base भनौँ न अथवा के भनौँ, its upper part is formed by the imaginary line. This imaginary line है. So imaginary line, this imaginary line between two epicondyles of humerus, between two epicondyles of humerus, है, two epicondyle of humerus, and the medial side there is the pronator teres, and then in the lateral side there is the brachioradialis. Okay, pronator teres is the muscle in the anterior compartment of the forearm, while the brachioradialis is the muscle in the posterior compartment of the forearm. And this from the cubital fossa. Okay, there is the laterally the radial nerve. So laterally radial nerve. There is the bicipital aponeurosis, and there is the brachial artery, and there is the median nerve, and there is the ulnar nerve just behind the medial epicondyle. Okay, so radial nerve from lateral to medial, radial nerve. There is the bicipital aponeurosis, and there is the brachial artery, which is literally divided into the radial and ulnar artery. So there is the brachial artery, and there is the median nerve. Okay, there is the median nerve, right? So median nerve, त्यसपछि चाहिँ ulnar nerve है, so ulnar nerve चाहिँ खासमा पछाडि हुन्छ, त्यसैको कन्सिडर गरिन्छ, तर median nerve, brachial artery, bicipital aponeurosis, and radial nerve, these are the contents of the cubital fossa है. So this is the cubital fossa, and just above the cubital fossa there is a median cubital vein. So this is the most common site for vein puncture, अनि भनिसके. So just above the bicipital aponeurosis को अबमा भने पनि भयो. So this is the superolateral है. Okay, superolateral side भयो पनि भयो है. So okay, you can same figure, right? So this is the long head of biceps, sorry, this is short head of biceps brachii, and this is a long head of biceps brachii like RTO. So this is inner muscle is the brachialis, I guess. Yes, brachialis muscle. This is the insertion of the deltoid in the deltoid tuberosity, and this is the brachialis muscle, and over the brachialis, and so this is the musculocutaneous nerve, right? So musculocutaneous nerve. Okay. This is the musculocutaneous nerve, and this cut portion is the tendon of the pectoralis minor, and this is the tendon of the, and this muscle is the coracobrachialis. So the musculocutaneous nerve pulses the coracobrachialis and supplies the brachialis and the biceps brachii. So it first pulses the let's say, right? So musculocutaneous nerve ले चाहिँ यो coracobrachialis लाई छेड्यो, यो हेर figure. Okay, यो so coracobrachialis लाई छेड्यो है यहाँ हेर. So this coracobrachialis चाहिँ यहाँबाट छेड्यो, so यहाँबाट निस्किरहेछ. So coracobrachialis लाई पर्स गरेर it will come under the biceps brachii and the brachialis है. So biceps brachii and brachialis लाई सप्लाई गर्ने भयो, then it goes towards the lateral side of the arm है, lateral side of the forearm. So to it supply the skin of the forearm. So lateral side को skin of the forearm. So this is called as lateral cutaneous है, lateral cutaneous nerve of forearm. So lateral cutaneous nerve of forearm. So यसले forearm लाई पनि सप्लाई गर्यो, अनि forearm को lateral cutaneous skin लाई पनि सप्लाई गर्यो, it supplies the muscle. So यसको नाम चाहिँ musculocutaneous भयो. So this voice forms, so this is the lateral cord है, this is the lateral cord, and this is the medial cord. So posterior cord is just behind the second part of axillary artery है. So lateral cord को यो median lateral branch र median cord को यो medial branch, they will merge and form the median nerve, which is long, which runs down, and it is on the lateral side of the brachial artery, while in the medial of the arm it goes towards the medial side of the brachial artery. यसले क्रस गरेर medial side मा आउने भयो. So in the cubital fossa it lies medial to the brachial artery. And there is the bicipital aponeurosis, which is a flattened tendon, and there is a radial nerve which has a deep branch and the superficial branch. Okay, this is a deep branch of radial nerve. So this is a deep branch of radial nerve, and this is a superficial branch of radial nerve, and there is the brachial artery. And brachial artery is again divided into the radial artery and the ulnar artery, and this is the median nerve. Okay, this is the ulnar nerve. Okay, this is the ulnar nerve. This is just behind the medial epicondyle. Okay, ulnar nerve को branch हो यो चाहिँ सायद, I guess this is a branch of ulnar nerve. Okay, so at the यहाँ पनि हेर्न सक्छौ है. So okay, this is the brachial plexus. Okay, brachial plexus by original lateral pectoral nerve and the upper subscapular nerve, thoracodorsal nerve, posterior lower subscapular nerve. These are the branches. Right? These three are the branches of the posterior cord, and this axillary nerve and the radial nerve are also the branches of the posterior cord. And the musculocutaneous nerve is the branch of the lateral cord, while the lateral pectoral nerve is also the branch of the lateral cord. So, and there is a median nerve which arises from the lateral and the medial cord. Okay, medial cord को branches पनि छ. So there is suprascapular nerve that arises from the upper trunk, and there is a dorsal scapular nerve which supply the rhomboids, and the levator scapulae which arises from the C5 root. Okay, so this is the okay, that's the upper trunk. So there is a nerve to subclavius also. This is the ulnar nerve, which is more medial. This is the median nerve, which is just lateral to the ulnar nerve, and there is the musculocutaneous nerve. There is the radial nerve in the radial groove, and there is the axillary nerve in the posterior side of the neck of the humerus. Okay, so okay, this is the lateral cutaneous nerve of forearm, and there is the radial nerve. This is the deep branch of radial nerve, and there is also the deep branch of the median nerve called the anterior interosseous nerve. So deep branch of median nerve called the anterior interosseous nerve. So that much for today. Okay, I guess लगभग आर्मको लागि यति नै पुग्छ है, सफिसिएन्ट है, सफिसिएन्ट. अब फोर आर्म पढ्छौँ है, जस्ट रिभ्यू गरेर.